And this is my presentation for AEE311, Communication Methods and Media. This is my assistant, Cody, who will be helping me this evening describe to you how to know when your horse is ill, what common illnesses they may be experiencing, as well as what to do and how to avoid them. 4 common illnesses that horses experience that we're going to discuss are colic, abscesses, founder or laminitis, as well as respiratory issues or colds. A common way to know that your horse is experiencing colic is if they come up, if they're in their stall and they roll, or they're kicking or biting, as well as if they're stalled constantly, if there's no poop in the stall and they haven't been drinking. As discussed earlier, you can also check the temperature, pulse, respiration, and capillary refill to determine if your horse is experiencing some sort of symptom. Now, when your horse is experiencing respiratory issues, normally there will be a cough, as well as mucus from the nose. You want the mucus to be clear if there is any. As you can see, Cody has a little bit of mucus in his nose, but it's clear. You don't want to see greenish, white, or thick mucus, as that is an indicator of infection. Now, when you talk about abscesses, normally your horse, if it has an abscess, is going to be lame, which means they're going to be limping or they're not going to be able to move very well. And there may be heat or swelling. Typically, abscesses are found in the feet. And so, when you have a foot abscess, that you need to look for, the main indicator is there's a digital pulse right here behind the foot. If you can feel that pulse, and just like with a person, don't use your thumb, but if you can feel that pulse, that means that there's increased blood flow, and so there's an issue there. The swelling may be down there, they may be tender. Typically, you'll feel some softening on the hoof where that abscess may blow, and the horse is going to be pretty uncomfortable. The last ailment that we're going to talk about is founder or laminitis. Founder is when the laminae in the hoof, which hold up the toe bone, inflame and they're weakened, they fray, and if it's allowed to go long enough, they'll actually break, which allows the toe bone to go through the sole of the foot, which is the bottom. And as you come in closer and look, now as you look closely, here we have the bottom of the hoof. Right here is the frog, which is the shock absorber for the horse. Here is the sole, which we are discussing in regards to founder. This is where the toe bone will come out. And as you can imagine, this can be extremely painful for a horse, and they will not be able to walk and normally must be put down after this happens. There are many similarities between founder and colic and how they cause the disorder. Founder and colic can both be caused by overeating, drinking cold water too fast, as well as having access to really green and nutritious pastures for too long, increasing sugar in the horse's diet. Now, founder and abscesses can be caused by concussion to the foot, and that can cause the toe bone and the laminae to be impacted, inflamed, but in abscesses, it can cause bruises, and sometimes, even if you have shoes on your horse, they get abscesses under the shoe, so they have to be taken off by a farrier to allow that abscess to be relieved. Respiratory issues can be caused by infection and from contact with horses who already have the disorder. That's why it's extremely important to make sure that the horses coming onto your farm, or when you go to a show that your horse comes in contact with, are not displaying any sort of signs of illness. One of the key indicators that a horse is foundering or has foundered is their stance. Horses that have foundered normally try to keep the pressure off their front feet because they hurt so bad. So you'll see them with their front legs extended and their back legs kind of pushed out, so they're what's called parked out. Horses that are foundering will exhibit this same sign and will not want to walk. And horses that have foundered, a lot of them, even if they recover, will still exhibit this sign, as well as you can see the signs in their feet from where they grow. Now, a common question that a lot of vets and professionals in the equine industry receive are, what do we do if our horses display these signs? Well, when a horse is colicking, if you can, get them up. A lot of times when they're rolling, they're twisting their guts, which if it twists hard enough, you can't untwist them without surgery. And that's a very difficult surgery for a horse to go through. So if they're colicking and they're laying down or they're rolling, try to get them up and walk them. This allows them to move their muscles and keep their stomach from getting twisted. Shouldn't make them walk though if they're displaying signs of not being able to do it. That causes undue stress on the animal and can actually make the situation worse. If you can just get them standing, even if they can't move forward, it goes a long way to helping them out. You also can give your horse, if you have access, to oral Banamine or the injectable form of Banamine. But it's very important that you follow the label on the medicine itself, and if your vet does not recommend using it, do not use it. It is important to call and contact your vet as soon as your horse starts displaying symptoms, just in case the horse needs to be tubed, given liquid charcoal, or even if they need to be taken to the veterinarian hospital to have surgery. Now, if your horse is displaying respiratory issues, the first thing you need to do is isolate that horse. If they're in a pasture with other animals, make sure to take them out. And if you have a stall, like this one over here, that is isolated from the other horses in your barn, that is an ideal place to keep your horse until the vet can come and examine them. The horse is coughing and wheezing. It can spread the germs very easily to the other horses, and as here, the horses can actually touch each other, and that is the easiest way for them to contract the disease, as well as if they're out in the pasture together and touching and drinking from the same water, possibly eating the same hay. So it's very important for respiratory diseases to isolate as soon as you see any indicators. And the horse will probably need to be put on antibiotics, so it is very important to call your vet, because a cold can turn into an upper respiratory issue. Upper respiratory issue can actually turn into pneumonia for horses, and it's very hard for such a large animal to not be able to breathe, and there can be long-term damage. In examining abscesses, what do you do? Well, most abscesses do not require immediate attention from the farrier like colic, respiratory issues, and founder do. For an abscess, you can use many different medications over the counter to help draw an abscess out. Now, if it does get bad enough, a farrier and a vet may need to be called to help dig that abscess out. As we move over here, we're going to look at some of the ointments that you can use to help draw that out. Now, soaking your horse's foot in Epsom salts and iodine and very hot water can help to soothe their feet and take some of that pain away. Now, you can also you can pat the hoof. Most people's favorite choice is to use Epsom salts. So as you can see here, just fine-grained Epsom salts, and then an ointment called Ichthymol. It is very important when you use Ichthymol to use gloves. But as you can see, it's a black tarry substance, so when combined with the Epsom salts, it makes a very nice, packed, cohesive ointment that can be placed in the bottom of the hoof. Now, after you place it in the bottom of the hoof, you can take a baby diaper, size depending on how big or small your horse's feet are, and you can duct tape it so that the pack actually stays for a few hours. Ichthymol is a drawing salve, so it will draw the abscess and all the pus and nastiness out of the foot. Sometimes, depending where it's located, that can't be done without a farrier or a vet's help. So it's important that if your horse has an abscess for a long period of time, that you get it taken care of, because it can cause permanent damage because they compensate for the pain in their legs on all the others. In regards what to do when founder happens for your horse, you should immediately call your vet, because depending how bad the founder is and how far along your horse is, depends on how good their recovery is. It's important, just like with colic, to walk the horse, but don't force them to walk. The increased walking can increase circulation in their feet and relieve pain, but it can be more painful for them to walk. So they may absolutely refuse to get up and walk around. Now as well, if your vet is not immediately available that very evening to come out, or even the next morning, you can give 2 grams of bute per 1,000 pound twice a day for your horse. But you need to discuss that with your vet before you begin that regimen. And as well as with colic, you need to be very, very careful with what you feed. Most horses with colic don't need to be fed at all and should not be allowed to drink until the vet sees them. Now with founder, it's a different case, because if the vet's not readily available for you, you need to probably just stick to hay. And don't feed them rich hay if you can, like alfalfa, because that can cause even greater issues with what's already going on in their body. The most important thing for when your horse is foundering is to get them to soft ground and somewhere where they can take some pressure off their foot. If you keep them standing on concrete or on gravel or really hard packed dirt, that just increases the pain that they're having because of the hard ground pressing against their feet. You can get them to soft ground, it allows their feet to sink in and not have that constant pressure right up against the bottom of the foot. This is key in helping your horse's pain level and relieving it without any medication. And they may be more willing to walk for you when they reach softer ground. If you're unsure if your horse is actually ill or if they're just displaying kind of mild signs, there are different vital signs that you can check for your horse to make sure that they're not actually ill. But it's important that if you do this, that you have a baseline for your horse. So you should periodically take your horse's temperature as you own them so you actually know what is abnormal for them. Some horses may be high or low in their temperature, depending on their own personal body. Now there is an optimum temperature, an optimum pulse rate, and optimum respiration rate. A horse's pulse should be 28 to 44 beats per minute. Now, if a horse is younger, say a foal, their pulse may be a little higher. Respiration should be 10 to 24 beats per minute when resting. Now, you may think that for respiration, you can just come up here and put your hand and count the breaths. But when you do that, the horse may actually alter their breathing to either sniff your hand or to stop sniffing your hand because they think it smells bad. The best way to tell how fast your horse is breathing is to stay here and actually watch the stomach come in and out. So as you can see, Cody's stomach will come in and out. That's one breath. Now for the pulse, the easiest place to feel the pulse is normally right here under the jaw. There's a very big artery that runs right here, and you can feel the pulse. Now the other vital sign that you can check is temperature. How do you do this? Well, it's really hard to do an oral thermometer, so we do a rectal thermometer. It's very important that you lubricate the thermometer before inserting it into the horse. Some people prefer to use water. Some people prefer to use Vaseline. Depends on your horse because they can have allergies to Vaseline. It's very important if you're not going to stand right next to your horse and keep hold of the thermometer that you attach a string with a clip so that you can actually clip it to the tail so that the horse does not suck the thermometer up. Now, Cody's very good about this, so I'm not as worried, but it's important because some horses may either be in pain or really just not like you back here. So when you're doing this, stand to the side. You're going to want to liberally put Vaseline or water, depending on your preference, all over the thermometer. I use a digital thermometer because it only takes about 30 seconds and it's very easy to get a reading off of it. So you'll want to pull the tail to the side and gently insert the thermometer. Now, my thermometer is going off. Cody's reading is 99.4. We know that's about normal for him due to records that we have on him. Your horse is generally happy, loves to eat, runs around in the pasture, and you notice when he goes out one day, he kind of just stands there, doesn't want to eat, is kind of grumpy, then that's a key indicator that there's probably something wrong. The other thing you need to check for, which is key in colic, is gut sounds. And you can lay your head against the horse's stomach right about here and listen for gurgling and any noises that are going on in the stomach. As we discussed throughout the presentation, knowing what your horse's pulse, temperature, and respiration normally are is key. So keeping a record book for your horse, and if you have multiple horses, for them, knowing when they've been vaccinated, had their coggins done, teeth checked, been worm blast, and had their feet done, can help you maintain and make sure that your horses don't experience any of these illnesses we've discussed. Keeping proper feed and nutrients for each horse, depending on how much they exercise and how much their body needs, because each horse is different, just like people are, and determining how much they need to eat. You also should be aware of how the environment and temperature changes can affect a horse and their appetite. If the weather goes from drastically hot to cold, or vice versa, it can really affect how your horse eats and their internal body. I hope you enjoyed this presentation that Cody and I gave, and that you find it informative and helpful in your horse adventures to come.